Hi, Dr. Heather Rogers here, and today we're going to talk about rosacea. I actually was able to rope in my dear friend and fellow dermatologist, Dr. Carly Roman. So we're just going to break down what rosacea is and what you can do at home to take care of it and when you really should see a dermatologist about it. So I think in general, rosacea is a catch-all term for a sensitive red skin, and sometimes that sensitive red skin can be inflamed, and that can present in different ways in different people.
Yes.
Your skin is a living, breathing organ. It has to process whatever you put on it, and if you put too much on it, it can get angry and get more red and actually make your rosacea worse. When you have thin skin, when you have blood vessels close to the surface of your skin, it's going to absorb more of those chemicals, so you don't need to use a lot of different things to treat your skin. A little bit goes a long ways. In regards to specific products that are out there that people can buy to really help with inflammation, redness from home, what do you start people with when they're red and sensitive?
Two of my favorite commonly used active ingredients would be things like azelaic acid and niacinamide, both of which you can find over the counter.
And then in addition to that, things like zinc-based sunscreen. Zinc is anti-inflammatory, so that's going to settle down your skin. So when you're really revved up, you pull back on your vitamin C because that's an acid and can make things worse. You pull back on your evening treatments, your glycolic acid, your retinol, and instead you can add in calming things, creams that have niacinamide in them, or actually singular ingredients like niacinamide, azelaic acid to really settle things down. You don't have to do that necessarily forever. You do it till your skin feels and looks healthy again, and then you can add back in your treatments. But when your skin's inflamed, asking it to do more with vitamin C or acids isn't going to help the situation.
Exactly. And the other thing you mentioned too is using a zinc-based sunscreen, which will calm things down, but also a common trigger would be things like the sun. So just making sure that you're really proactive about your sun protection, that will help reduce a lot of the redness or that kind of erythrotelangiectatic subtype. Other common things that can flare it would be like heat, exercise, spicy foods, so sort of doing what you can, alcohol, doing what you can to kind of minimize those triggers.
And triggers are different for different people. So just because somebody else gets triggered by caffeine doesn't mean that you are. You might be triggered by red wine, so you do need to listen to sort of what gets you going, and lack of sleep and stress gets everyone going. Outside of what you can do at home, if it's not being contained, if you're really frustrated, if it's affecting your daily living, that's when really coming in and seeing an expert is going to make a big difference. And this is sort of a hard question to answer shortly, but like in regards to orals, topicals, and lasers, like what do you do for someone who's 35 and just constantly having rosacea flares?
I think we like to keep it simple, or at least start simple. So we would start with maybe prescription topicals. If they're really inflamed and especially have a lot of that sort of papular or pustular component, we could add an oral as well. And then really in the winter, which, you know, thankfully we're approaching the summer now, winter lasering helps a lot, but specifically it's more targeted to that redness type.
And in addition to that, these things are not things that you have to be on for forever, but you have to try them, and you have to try them for usually several months to really get a judge on when that's going to help you. And then oftentimes, as we sort of go through different phases in our life and our skin barrier gets better and stronger, some of these flares can be controlled, but the propensity for them will always be there. So it's not like we can cure you of rosacea.
Exactly. It's kind of like you're in this sort of like maintenance mode or sort of prevention mode, and then we have to react sometimes when, you know, life happens, stress happens, certain triggers happen, and you flare up a little bit.
So in summary, in general, there's a genetic predisposition, so don't be mad at yourself that you have rosacea. There's nothing
Totally,
you can
can't
do.
fix genetics.
Can't fix it. When you feel like your skin is sensitive, listen to it. Do less, be more supportive of it. There are things you can do over the counter. The two ones that we talked about primarily are niacinamide and azelaic acid. If those aren't doing it, then that's really when you want to involve your doctor, your dermatologist, for stronger, more comprehensive ingredients. There is one other thing we didn't talk about, where sometimes your rosacea is brought out because your skin barrier and your skin biome is not as strong as it could be. And for a significant group of people, taking a skin probiotic like the Skin Squad can actually make your skin more resilient, less reactive, and better able to tolerate the world. That's not for everyone though. And then in addition to that, outside of orals and prescriptions, lasering, particularly lasering for red, can really help move things backwards once your active inflammatory rosacea is controlled.
Yeah.
All right, if you have any questions, just DM us below, and have a wonderful weekend.